Hello? Who? I think you, Rick. Hello? Yeah, you're used to that, Rick. You're used to this. Can you hear me? Yeah? No, I know. Can you hear me okay? Yeah? Okay. So welcome to the World Heart Federation Heart Cafe. We're going to be talking about... Yeah? For you it's good?
Het geluid is heel
Wait,
slecht.
he cannot hear me.
Ja, ik kan hem het geluid is gewoon slecht. Ja, maar ja, ik moet hem ook horen natuurlijk. Het klinkt heel dof.
Can you hear me or not? Yeah?
So I can hear you here, but I'm not sure whether the audience.
Okay. Do I start? Yeah? Okay. Welcome to the Heart Cafe of the World Heart Federation. We're going to be talking about Global Heart, the WHF official journal. We're very happy to have here the chief editor, Rick Grobbee from Utrecht University, and Kirsten Klapsten, an editor of the journal as well. So welcome, both of you. Thank you for being with us. And we would like to hear about what's Global Heart. What's the scope of the journal? What articles do you publish? Please, Rick.
Yeah, what's Global Heart? Well, as you said, it's the official journal of the World Heart Federation, so it fits in the scope of the World Heart Federation, aligned with the strategy of the World Heart Federation. But what it provides is a international platform for publications on global cardiovascular health and equity. Research, education, debate could take any form. Different types of research. We have, like clinical papers, but also population health, systems research, health technology, epidemiology. So it's a broad range, but it all strives to inform about global cardiovascular health issues and have implications for global cardiovascular health.
Okay, and what's the model? I mean, these days with open access and so for any author interested in publishing.
Yes. So fairly recently, a few years ago, we changed to open access. And we have seen that really improves the access to the journal. The number of downloads, for example, across the world has been remarkable and increasing over the last years. Now, as you know, open access doesn't mean for free. Someone has to pay for it. So authors are charged a publication fee for papers that are accepted in the journal.
Okay, and do you have any special policy according to the nationality of the authors?
Yes, the journal is not for profit, and therefore we have a policy of waiving part or whole of the APCs, depending on the economic circumstances of the authors.
Okay. So you talk about the scope that is, I mean, global cardiovascular health and different type of studies, but maybe you, Kirsten, you can tell us what specific, different from clinical cardiology, what type of articles are we looking in Global Heart? Can you talk a little bit about, for example, I think implementation research, that is a type of articles that are quite common published in Global Heart. What do they look like? What are the unique characteristics of this type of research?
Yeah, so generally the journal is inviting for very, very broadly for very, very different studies using very, very different study designs. But of course, the implementation research focus is also an important one because very, very, very often we do know about interventions that in principle should work very well, but we do not know so well how would they need to be contextualized and what would really need to be in place to make sure they are also then efficiently working in very, very different settings. So being in a position to also publish this research then can also guide policy and practice in the long term. And I do think that does fit in also very well with WHF's overall aims and goals.
And I mean, going back to difference with kind of traditional, more clinical epidemiology studies, I mean, what can you say about tips in terms of good implementation research studies? What would be your suggestion for maybe authors that are interested in submitting papers to Global Heart? What are we looking at? What would be some tips to submit strong papers? Any suggestion for authors?
Like with every study and with every study then also submitted to any journal, the methodology should be very sound, and that is also the case for implementation research. So there are also quite a number of underlying methods and models that are very good to consider, then also to inform how to set up the study, how to undertake it, how to report it, and then also how to write it up and to communicate to the wider audience. Yeah, and I would say we are also particularly interested to hear about how effective interventions are really implemented in different settings and what would be needed to do so in those different settings, because what works in the Netherlands does not necessarily work in France, but it also does not necessarily work in Nigeria or, for example, in Indonesia. There are so many contextualized factors, and without knowing about those factors and without having also the local input and the local engagement with all necessary stakeholders, it will be very difficult to give guidance and also how to do things in practice.
Yeah, and I think, I mean, you touch on two things that are quite important for global health and I think important for Global Heart papers, that are the equity angle, and I think looking at inequalities in terms of countries, but also even within maybe high-income countries, also looking at inequalities. I think that's part of the focus of global health in general. And the other methodological is the multidisciplinary, because in general, for many of the implementation research, you need to have authors that are coming from maybe from social science or from health system research. And that, I think, it's an increasing research field that I think Global Heart is leading in terms of cardiovascular health. What about the timelines, Rick? I mean, in general, how
the timelines, if you take it all together between submission and availability on the web, open access, is typically around 5 to 6 months. And in that sense, we are doing quite well compared to some other journals. We also have a policy of quick screening of papers once they arrive. Currently, the acceptance rate of the journal is about 35%, so 65% is rejected for whatever reason, and 50% is rejected immediately. And that is good for the authors, so they know the fate of their work. But it's also good for the system because it's a lot of work. All our papers are reviewed. We have editors that need to manage that. And there's typically also revisions. And in fact, revisions take a lot of time. But they are entirely in the hand of the authors, of course. But this is the overall time scheme. Once a paper is accepted, it takes some months before it's edited and formatted and available online.
Okay, and you were talking about the editors, and I think considering that global cardiovascular health is the interest of the journal, can you tell us more about the editors and where they're coming from?
Yes, the editors are, we have now some 20 editors, and they are really from everywhere on the globe. So I think that all continents are represented, some somewhat more and some somewhat less. We are currently expanding the boards because we see increasing numbers of submissions, so the workload is increasing. And in expanding that board, we have a policy of inviting younger editors. So in fact, we have just selected 5 editors from the group of emerging leaders of the World Heart Federation, again, from different countries. We also strive to have a good balance between men and women, and of course we need a wide range of expertise. As you mentioned, it's not only hardcore epi or hardcore clinical cardiology. Sometimes it's systems research, sometimes it's qualitative research, sometimes it's social sciences. So we need, among our editors, we need those expertise fields in order to be able to manage those manuscripts well.
Okay, thank you. I don't know if there is any question from the audience. Hi. So you were mentioning all those type of potential studies. We talk about implementation research, and is there any area in particular that, I mean, we're welcoming and we would like more papers? I don't know, on any particular topic that we feel like there is an important need and we can encourage?
It's very hard to really be that selective because the beauty of research is that it comes into the minds of investigators who have ideas and they find relevance. So in that sense, we're looking at quality, perhaps more than dictating what it should look like. Maybe in addition to what you just said, Kerstin, about what features of papers are important, and that holds true for implementation research, but also for other forms of research. All the research that we publish should have relevance outside the setting of the investigators. And that is something that we sometimes see lacking, that it's very, very local. And that's fine, but then an international journal is not the right platform because we want our readers from different regions in the world to learn from the search for their own application. So authors need to be aware that we judge papers on their impact outside their own corner of the globe.
Yeah, and I think that's part of the challenges in general of implementation research, where you need to be context specific. So you need to adapt, for example, an intervention to your context, to your policy. But at the same time, the knowledge generated there can be informative to other settings. And that part of, unlike maybe more traditional clinical epidemiology, that you have a lot of emphasis of internal validity, and you can translate a clinical trial result to other setting. For implementation is a challenge, but that brings, I think, the importance of other disciplines like social science, because when you have a theory behind the implementation research, you can apply some of the principles to other settings.
Exactly. So it can be context specific, but then the context needs to be specified, and hardly any context is fully unique. So, but as long as you're able to demonstrate in your work that what you've learned from a specific setting under certain conditions is applicable elsewhere, then it's of course useful.
Okay, and I know, I mean, we've been talking, as part of the editorial team, that there are different ways of measuring impact on a journal. Of course, we are used to impact factor, so maybe you want to hear about that in Global Heart, but also in general, what's the impact and different ways of measuring impact that you have at Global Heart.
Yes, impact traditionally is measured by impact factor, which is a very simple metric. It's the number of citations per paper that's published over a period of 2 years. Currently above 3 for the journal. It has been increasing initially, clearly, and it's of course one measure, but we feel that it's a bit of a limited measure if you look at our audience. Our audience is not only researchers that are going to cite. It's also people working in the field that want to take that knowledge on board. So other measures like numbers of downloads, for example, and visits to our sites to us are equally important, if not more important. And that is something we see really rapidly increasing. And from all corners of the world. That's quite amazing. So in that sense, I think the journal has a wide reach, and not only to scientists, but also to healthcare workers, to people that want to benefit from the knowledge shared. In that sense, it's also important to mention perhaps that, for example, roadmaps that are about implementation of guidelines, crafted by the World Heart Federation, are also typically published in the journal. And these are papers that may not be cited that much, but they are hopefully guiding implementation of guidelines in the real world.
And of course, those roadmaps are also taking up a lot of the already published evidence. So also then ensuring that there is a long-term impact and also of many studies that are published by various journals, including then, of course, also Global Heart.
And can you give us an example of some papers that are more widely cited from Global Heart? I mean, what type of papers?
Well, we took, you were mentioning, are we soliciting for certain work during the pandemic, of course. We had a special section, if you wish, that focused on impact of the pandemic on cardiovascular care, impact of the virus on cardiovascular health. And that series of papers, including some reviews and consensus reports on management, have been cited extremely well.
Okay. Any other example that you're aware of? Any Global Heart paper that comes to my mind as, I mean, a good example of our scope of any?
Not one that's directly on my mind, but of course you're also publishing many comparative studies. Also many studies now drawing upon large-scale registries or large-scale databases. And those papers are of course also important papers to be picked up then in subsequent research.
And looking into the future, any new initiative from Global Heart or any new thinking, Rick?
Yes, realizing that as we've mentioned, it is, on the one hand, high-quality research, but also more than research only. We feel that we can utilize the platform as it stands now, perhaps even better in communication with our audience in the world. Also in view of the objectives of World Heart Federation. So one thing that we're going to launch later this year is a podcast where we will discuss a few papers, not only Global Heart, but important work that has been published in other journals also, to try to put that in perspective, to also invite authors or experts that can give background information. We hope that the listeners then also respond to that, so we will open a forum on our site where people can put comments or critiques or whatever. So make it not only a journal in digital form, but also a platform for exchange and ideas.
Yeah, and I think, I mean, the digital platform, I think a good example is this. We are talking here at ESC, but this is being recorded, and I'm sure many of the members of WHF will see this video, and hopefully they will submit more papers to Global Heart.
Sure.
I think it's a unique journal in this. There are not many journals looking at the scope of global cardiovascular health. It's increasing. There is a really important journal to disseminate research on this topic. So I don't know if there's any question here. I think
a microphone. Yeah.
Do you think there is a role for the journal to fight misinformation and wrong medical information?
Sorry?
To fight misinformation. Do you
To fight
envisage this
misinformation?
as part of your remit?
Well, you're touching on a sensitive issue because the world is full of misinformation. And we have a number of measures in place to at least try to prevent that from happening. And the cornerstone of that is the peer review system. So we have a couple of layers. We have the initial check by the team in the editorial office and myself. We have our editors, we have reviewers. We tend to rely on more than one reviewer. And that filters out a lot of problems that there are, you know. And it's not necessarily misinformation, but it's also, you know, sloppy methodology or information that is not really backed up by evidence in a paper. But clearly the world is changing, and we now have AI producing papers, and it may be hard in some instances to detect that. On the other hand, my feeling is that even if you use, you know, digital technology to improve your paper, that's fine, you know. It may even be easier for some people not mastering English to now write papers that are you know, well read. So fine, as long as the science stays behind it.
And if I can add, I think beyond, I mean, the our own process as a journal. I think the topic of misinformation could be, I mean, topic of research as well. I mean, there is ongoing research about how to counter. There is some works that they make even the parallel with the biology and how misinformation is a virus, and you can put measures, and they do experiments on these. And I think this whole area is an area of we are interested. We publish also papers that go beyond clinical aspects. One that is, for example, the reach of World Heart Day in comparison to, I think it was atrial fibrillation day. So these kind of things are within the scope of our journal, beyond clinical aspect. I mean, things that have to be with policy aspects and misinformation definitely is a thing that is coming as an important one. And I'm sure we will receive maybe papers on that topic as well. Any other question?
Thank you so much. What is approximately the percentage of studies that are coming from low and middle income countries? And are they more implementation studies or more research studies?
I would guess in the recent year or so that, and it depends a bit on how you define that. You know, is it the first author? Many papers are also collaborative papers with authors from different countries, but work that originates from low resource settings, I think it's about 25 to 30% in the journal currently, and that's you know, very different types of research. It's not only implementation research. I think that implementation research, again, definition, but is a minority, and that's also because it's difficult and it's an evolving field. So most of the work that we publish is in other settings or other scope, but there's a fair number of papers from low resource settings and a fair number of authors from low resource settings that reach the journal. Yeah.
And it's also a very good mix between population-based studies, but also clinical research. Also, very often clinical research based in low resource settings or based in countries in the global south. So we get a lot of papers also submitted from Asia, for example, very often, and also reporting about really clinical research that is undertaken there. We also have many studies that are drawing on international large-scale funded projects. And of course, there you would say, yes, there is an angle, then there are authors included from European countries, but there are also many authors then from elsewhere who do drive most of the research. So it's really a mix. And I think, you know, for the journal also to evolve further, the topic of the diversity and being inclusive, then not only with regard to authors, but also with regard to editors, is a very important one.
And a reminder that authors from low-income countries can ask for a discount fee because that sometimes is a barrier, but they have the possibility of ask for a discount fee if they're based in low-income countries.
I think what's also quite important to mention about Global Heart is we are also publishing a lot of mixed method research. And I'm not sure whether all the classic cardiovascular journals are doing it as much. But it also does talk to multidisciplinarity and looking at prevention and management of disease in a very different way.
Yeah, and I think as an evolving field, I mean, the good news is there are more and more, they're increasing reporting guidelines for this type of research, for implementation research, for mixed method, that also help the authors on how to report the results of the study. That I think we have the links in our website.
There are also many more reporting guidelines, of course, so it's always very interesting to look it up. It's not only any longer about how to report a clinical trial, but basically every type of study now has its own guideline, how to report it in the best way, to make also good use then of the reported information in the future.
Yes, and these guidelines can be found on the website, so we have instructions for authors. and it's specified there for the type of research, what is the prevailing set of recommendations on how to report it. The editors are sharp on that, so it helps if you take notice of that as an author to begin with. Otherwise, you'll find yourself revising your paper. But the recommendations are there.
Okay, so maybe any final message for our audience here? Oh, you have a question, sorry.
One last question. Do you publish also consensus paper on the low-income country?
Yes, we do publish consensus paper, but consensus papers are difficult territory. You know, you and I can have consensus, and the rest of the world not. You know, we can write a paper and we say consensus, but you know, what does it mean? So we try to have slightly more solid gatherings. So, for example, the roadmaps where there is a big team behind it, and there is peer review, and guidelines, obviously, that are evidence-based and follow the rules for guideline development, and also specify evidence. But sometimes there's a territory where there's not much evidence, and then it's good to have some consensus at least, even if you have consensus of lack of knowledge. But again, you know, consensus. We take that seriously, and it needs to really add to the knowledge. Otherwise, perhaps we wait until there is evidence summarized.
Okay, so I think now, yeah. So maybe Rick, I mean the chance to give a final message if you want to.
Message. Oh, yeah. Just before the question, I was on my final message. Well, it's nothing final because the journal is very alive and kicking. So I hope that the audience takes a look at the website. I hope they consider the journal for their work. They will have a nice platform for exchange. They will have a big reach. They are going to be part of a community, and the community will also be served by new initiatives like the podcast, first in December this year, so watch out for that. And again, welcome. And we also always welcome reviewers, because these are important. It is good to learn how to review. We will give guidance on that, and the editors will. So if you feel like wanting to review and learn from that and help us, then just send a message to the editorial office, and we take that seriously.
Okay. Thank you, Rick. Thank you, Kerstin, for your time. I think that's all from me, Pablo Perels, Senior Science Officer at the World Heart Federation. And this was another WHF Heart Café. Thank you very much.